No dairy product. Dairy product are also animal product. No refined food. Don't eat after 8 p.m. Be under sunlight for 10-15 minutes. This is together called DIP diet. So DIP diet has evolved in last 12 years. Even Government of India, Ministry of Ayush has done a clinical trial, randomized control trial on DIP diet. All India Institute of Ayurveda, they did it for 2 years, and they found DIP diet is very, very effective in the people suffering from various kind of inflammatory disease, bone disease, spondylosis, thyroid disease, etc. The DIP diet clinical randomized control trial done by Government of Nepal on a small trial, a 7-day trial, and they found it is within 7 days people can be free of diabetes medication, blood pressure reduces, even obesity also. Within 7 days they see substantial weight reduction. Clinical trial on DIP diet was done also in Malaysia, Lincoln University, and that trial was of 25 days. But this trial was on chronic kidney disease patient, and they saw the patient on DIP diet, they had increased their kidney functioning, the GFR. So when we combine the DIP diet with the hot water immersion, it becomes the therapy for chronic kidney disease. When we combine the DIP diet with the bucket therapy, it becomes a therapy for cancer patient. Or if it is a diabetes or hypertension patient, simple DIP diet, if they follow at least for 3 days, by 3rd day, most of them had to reduce their blood sugar medication, reduce their hypertension medication. Otherwise, they will land up in hypoglycemic stage, hypotension stage. So every month, I conduct one 72-hour camp in my hospital, and we invite patients from all over the country. And we have seen consistently, this we have been doing for last more than 10 years. India, Malaysia, Vietnam, UAE, in many countries we have been doing once every month somewhere in the world. And consistently we see that within 2-3 days of following the DIP diet, patients are able to get rid of their diabetes medication, get rid of insulin, get rid of hypertension medicine. So these things we see within 3 days. But then we ask the patient to stick to the diet for a long period so that these kind of problems or illness or diseases should not reappear. So whatever I told you, all these things are evidence-based, and for evidence, I have wrote 35 books, but one book I recommend, that is World's Best the DIP Diet. And in this book, all the things which I told you, all the evidences from our own trials by Government of India, Government of Nepal, Lincoln University, or the similar kind of trial elsewhere, we have collected and give it. And also we have included the testimonial and success stories of my patients. And if you go to www.coronakal.tv, you'll find more than 10,000 video testimonial of my patient. So here, what I promote is, if anybody want to get cured, they need not to meet me, need not to come to my clinic, need not to come to my hospital. Just the amount of knowledge which I shared with you, if they start doing it, they will start feeling the relief, they will see improvement symptomatically. So that means the cure is in your hand. You can become your own doctor, and it is very simple and easy. Rather, when they go to hospital, even a simple illness, the doctor present it in such a manner that the patient gets scared. When you get scared, then you follow whatever the doctor says. And I've seen all the cases, the conventional methods of treating is they're not treating the health, they're treating the disease. And the patient remains patient lifelong. Last 5 minutes I will take, and that is about the heart disease. My patient who come with angina, my patient who come with breathlessness, my patient who, whenever they walk, they are not able to walk consistently. They have to take rest. Whenever they climb stairs, they feel the pain, uncomfortable. So I say that you be on DIP diet for at least 1 month. And the moment they do it, interesting thing happens, that their breathlessness goes away, their angina goes away, their chest pain goes away, and their blood pressure reduces. That means they have recovered. And how it is happening, if you go by science, it says whenever you are on DIP kind of diet, means fruits and vegetable, a lot of fruits and vegetable in your diet, something interesting happens. The body releases more amount of nitric oxide. As a result of that, the collateral arteries, the arteries which are idle, those open up, and once those open up, then all kind of heart problem goes away. So it is, medical science says this concept as natural bypass. Natural bypass. This means your body is having the ability to open up new arteries on their own, but body can do it only if the production of nitric oxide is ample. How to increase the production of nitric oxide? Only one way: eat lot of fruits and lot of vegetable, as I told you in DIP diet, right? So whether it is heart patient, kidney patient, cancer patient, or patient of any infection like corona, or so-called corona, influenza, etc., the treatment, the best treatment is treating at home. It gives the fastest result, safest, long-lasting, do not involve much money, and do not involve much complicated diagnostic methods. So even only last 2 minutes, thalassemia patient, the children who need blood transfusion every month, and they are told for rest of their life they have to be on blood transfusion. But when these kind of children come to us, beside we give them DIP diet, we include one more thing we call as zero volt therapy. As you know, I am engineer also, so this is something which I understand very much, that when the body's voltage, like the electrical instrument, when the body's voltage is as zero, our immunity is strongest. How to make the body's voltage zero? The earth is known as 0 volt. So when you touch the earth directly, your voltage becomes zero within 10 seconds. And if you consistently keep yourself on the earth, that is walking barefoot on the grass, on the earth directly, then your voltage of the body remains zero. And once it happens, your hemoglobin level increases, the viscosity of the blood reduces. And if it happens, that means you will not need blood transfusion. I'm talking of thalassemia children. So we did a lot of patients testimonial and case studies, and we have found that my patients, thalassemia patients, either they do not need the blood transfusion at all, or even if they need, initially they need it every month, now maybe once in 3 months, once in 4 months. So this means when we use these natural remedies, whether it is the diet, whether it is giving fever to the body, or using the gravity as medicine, or 0 volt therapy, that means connecting with the Mother Earth, right? So one last word, you can try this next time when you are in stress, when you are in anxiety. You can try one interesting thing, that is, you go take off your shoes and the socks, and just sit like this and let your feet touch the earth directly. If you can do it for 40 minutes, you will realize even if the situation and surrounding remain the same, but your stress, your anxiety goes down. And finally, try this, what I'm saying now. If you happen to go to any other country, say you want to go to London, or you happen to go to US, so you understand jet lag. So how to my patient overcome jet lag? The moment they go to any country which is having in different time zone, I ask my patient, once you step out from the airport, take off your shoes and socks, find a ground or a park and sit there for 30 minutes. The moment they do it, our body clock, which we call as circadian clock, it reset itself, and within 30 minutes, they can get rid of the jet lag. I've written one book called Circadian Doctor, and you can read my book through the PDF or the ebook by going to bishwarup.com/ebook, BISWAROOP.com/ebook, and also about the 0 volt, that is when you ground yourself, your body voltage becomes zero. If you want to learn more about it, this book also is available at bishwarup.com/ebook. Most of the book are available there, free download, free ebook, and there you will find all the evidences, whatever I just said. And the most important thing is, you can become an evidence. Whatever I told, try any of them, and there is no harm in it. Try at home, And the moment you see your experience, if you see positive experience, you become an evidence. You will not need any other evidence. So that is all I wanted to share with you. It's my pleasure that you gave me opportunity. If you have any question, you are free to ask, and I will try to answer best of my knowledge. Thank you.
Thank you very much, sir. Sir, any questions? Any of you? Yes, sir. Kindly ask.
I'm myself Viresh Gachinmat, sir. I am from Dharwad, Karnataka. Good afternoon, Dr. BRC, sir. Namaste, sir.
No.
I'm honored speaking with you, sir. Thank you for giving me an opportunity to ask a question, sir. I'm both nervous and at the same time concerned while asking you this question. This question is not only mine, sir, but people like me, most of us have this question, sir. During lockdown time, sir. At that time, I had no fever or any symptoms which somebody can call. I was COVID patient, sir. I had no symptoms or no fever, but still, our department, the education department, I am a guest lecturer, sir. We were asked to take vaccination to save our job. I repeat, sir, to save our job, I have to take 2 doses of vaccination in the matter of few months, sir. Now, my question is, sir, if I have to get rid of this effect of taking this 2 doses of vaccines, what should I do? Or should I have to suffer that my action of taking vaccines, 2 doses of vaccines? Is there any way out that I already took vaccine and I should not get affected with that vaccine, sir? Please.
Yeah, thank you for asking question. This is a very commonly people ask me. And in 2020, when the vaccine was not still out, at that time only through our social media, through my books, I told that do not take this vaccine because it is not a vaccine, it is a slow poison. But unfortunately, under pressure, many of you have taken, including you, Viresh, as you are telling. Now we have to understand one very important thing, that it is for the first time in the world it happened then that mRNA vaccine is given. mRNA, it is a different technology altogether, a new technology. And it is changing, it goes reprogram the mitochondria, the cells of the inside, it works inside the cell, right? So how to detox? There cannot be a clear-cut answer to it. Whether we'll be able to detox from the side effect or unexpected side effect of the vaccine, we do not know. But with all this limitation, still what we can do is, as I told you, be on DIP diet, the diet which I've explained. So probably this diet will help you. DIP diet is nothing but eat more amount of fruits and vegetable and reduce the amount of refined food, amount of all kind of animal food. This is DIP diet. Don't eat after 8 p.m. So once you start doing it, as I see that most of my patients, whatever be the disease, they improve. So I'm hopeful that when you do it, it will help your body to come out of all the toxicity which is filled inside as a result of vaccine. So this is what I can recommend, and this should work a little bit. So that is what I can say at this moment.
Thank you, sir. Thank you for answering my question, sir. Thank you. Namaste, sir.
Yeah. Anybody have more questions? Anybody is having questions?
BRC sir, very nice advice from you. I'm Prasanna Bathabat here. Sir, for a general health, without any currently any problems, a normal man or woman, what should be your advice, the lifestyle of the person, sir?
See, first advice is you have to get rid of all the drugs which you are taking. No one can remain healthy while taking diabetes medicine or BP drugs, etc. How to get rid
not taking any medicine, sir.
of these medicines?
Not taking any
as
medicines.
I told you, yeah. If not taking any medicine, the best way, as I know, is be on the DIP diet. That means more amount of fruits and vegetable and reduced amount of animal food or zero animal food, and no or reduced amount of refined food. Don't eat after 8 p.m. Important is don't eat after 8 p.m. And every day for 30 minutes, if possible, stay grounded, connect with the earth. Because when we connect on daily basis, we get a direct electron from the earth, and electron reduces the inflammation in the body. So connecting with the earth, little bit of sunlight, connecting with the earth every day, little bit of sunlight every day, be on DIP diet the third thing, and the last thing, don't eat after 8 p.m. Better is don't eat after sunset. You can do all these four. And if you can do it for about, say, as an experiment for 1 week, you will realize your sleep will improve and your energy level will remain improved. You'll be more energetic, and your concentration will improve. And if there are some kind of body ache or some kind of knee pain, something else which is bothering you, those will start reducing. So these four pillars: sunlight, that is up in sunlight, get connected few minutes, down earth, get connected few minutes, about 30 minutes, be on DIP diet kind of thing, and don't eat after 8 p.m. Better don't eat after sunset. If these are the four things one can do, I hope that will be healthy always.
Thank you, sir. Thank you.
Sir, I am Professor B.B. Jha from RIT Bangalore. I have one small query from you, sir, that with the age, the fluid generation at the joints as well as the limb also, they are getting weaker and weaker. And nowadays people are going for the complete replacement of their bone or the knee joints or all kinds of things, because you cannot stop, the deterioration in all these joints and bones. And they are mostly that hydroxyapatite content things and all that. What is your comments that how suitable those replacement are with respect to the deteriorated structure of your body, which has taken long time to bring it to that level?
That is a current practice, that the joint replacement, hip replacement, these are being promoted by the doctors. It is similar to when our car which we are driving, if any part of the car is not working properly, or eroded, then we replace that part. So same, the doctors, they are trying to do with the human body, but the human body is not a car, and I discourage people for going for any kind of replacement, like hip replacement or joint replacement, surgery to be avoided. Now the question is, if this surgery to be avoided, then what to be done? What we do in our hospital to give a relief to the patient, that is the four pillars which I just told Venkatesha or all of you. These four pillars we definitely do. In addition to that, we include one more thing, that is called Ayurvedic Panchkarma. That is giving Panchkarma to the place, localized heating, the place which is paining or which is bothering. So we combine Panchkarma therapy along with diet, along with other elements which I shared with you, and within 15 days for most of our patients, we see the patient with great amount of relief, definitely. So whatever may be the situation, the surgery cannot be an answer. It may sometime or many times makes the patient immobile. That means it becomes worse. So better the conservative way, change the diet, change the lifestyle, don't eat after sunset, and be with sunlight, be with earth. Along with that, use Panchkarma therapy, localized Panchkarma therapy, and that should immediately address the problem, and the pain and the discomfort should reduce very, very quickly, and it may take about 1 month time, but the patient get relief to a great extent.
Thank you, sir. Thank you very much.
Thank you. So with this, we come to the conclusion, and it is great for me to get an opportunity to see all of you. So now my next meeting is there, and also as given the time, so I thank all of you for listening to me. And BP Harishan, I will send you all the links, and if I get the address, then I will definitely send this calendar as a gift from my side to all of you, so that we remember each other. Thank you.
Thank you, Vishnu sir.
Sir, if you share your mail ID,
So-
sir, we can correspond.
एक्चुअली
share your
जब
mail
भी
ID,
हम राजू भाई के साथ घूमते थे ना, तब राजू भाई ने बोलते थे कि भारत माता कभी भांज नहीं हुई, कभी विवेकानंद पैदा होता है तो कभी दयानंद पैदा होता है। तो उसको ऐड अभी ऐसे कर भी सकते हैं हम, कभी राजू दीक्षित पैदा होता है तो कभी विश्वरूप राय जैसा हीरो पैदा होता है। सो यू आर डूइंग अ ग्रेट जॉब, so you are a great son of Bharat Mata. So Raju bhai used to fight against all lobbies of MNC companies and exploitation of MNC companies. You are fighting a lobby of pharma companies. Thank you for being with us and contributing a lot of knowledge to us, sir. So we are very grateful to you. Thank you, sir.
I wanted if you can share your mail ID, sir.
Again, opportunity to see all of you in person, and with this, that I conclude. Thank you, all of you, for patiently listening to me. Thank you. Dhanyavad.
No, Harichandra will take. Hari bhai, are you there?